Welcome to the Tennessee Community Engage Alliance Against COVID-19 Wellness Wednesday show, also known as TNCO Wellness Wednesday. I am Dr. Katherine Y. Brown, your host. Now, more than ever, we must stay informed and engaged about the COVID-19 pandemic in Tennessee. Our communities in Nashville, Memphis, and surrounding areas must increase our understanding of the factors that contribute to the disproportionate burden of COVID-19 in underserved communities of Tennessee. Throughout our conversations on this show, we have been introducing you to thought leaders that are establishing effective community engaged strategies that are aimed to increase knowledge, awareness, testing, and vaccine readiness as they work to address structural inequities and COVID-19 disparities. It is with much excitement that today I have the honor to introduce you to my colleague and my friend, Monique Anthony. Monique Anthony serves as Director of the Office of Minority Health and Disparities Elimination for the Tennessee Department of Health. Welcome, Monique Anthony.
Thank you so much, Katherine.
I am so excited to have you here. Now, I am very familiar with all of the amazing things that you do in the community, but can you tell our viewers a little bit about your background, your work, and some of the accomplishments in your current role?
Well, thank you, Katherine. I thank you for the opportunity to be here with you all today. And so, in my current role, well, the Office of Minority Health and Disparities Elimination, we seek to empower communities to support optimal health for all, to achieve health equity and eliminate disparities for racial, ethnic, and underserved populations in Tennessee. And so, we seek to do that through meaningful collaboration and engagement. And so, with that, our office strives to be that bridge for our agency, between our agency and the community and our stakeholders to make sure that we're able to bring the minority perspective to our agency and help not only our agency internally to be able to produce innovative interventions that will help communities of color, but also have our stakeholders at the table with us from the beginning of the process, being able to plan and strategically implement resources that would be meaningful for the community. So that's one of the many things that our office is able to do within our particular agency to promote health equity and to make sure that that the engagement of minority communities and the needs of minority communities and their voices are at the table as decisions are being made. Um, so that's a little bit about our office.
Mhm. I love that. And one of the things that I think is so innovative that people need to know about the work that you and your team do is that it's not just about being at the table, it's about listening to the voices and making sure that the community and your stakeholders are part of the process. So I want to definitely commend you and say thank you for that amazing work. I want to pivot a little bit because now we're dealing with COVID-19. So, how has your office been involved with COVID-19 or even the vaccine in the community?
Yeah, so I mentioned that we want to make sure that we have meaningful collaboration. And so we've had many partnerships, particularly at Meharry Medical College. We have many partnerships across Meharry Medical College, including the TNCL project and the HBCU Wellness Project. Just to share a little bit about our work within those particular partnerships. We work with TNCL to coordinate statewide community engaged response to inform mitigation efforts to reduce the spread and adverse outcomes of COVID-19 among vulnerable populations. Many of the partners that make up the Tennessee SEAL project are involved with COVID research, testing, and prevention activities that will help to conduct community engaged research and other experiences with working with vulnerable populations. And so periodically, Dr. Juarez, Dr. Stewart, or Ms. Williams will present the activities of the SEAL project to our Tennessee Health Disparities Task Force to receive input and feedback from us and the group. This Health Disparities Task Force includes many people, 100 plus membership from all across the state, from academia, public health legislators, other public health professionals, community faith-based organizations, as well as our representation from our fairly qualified community health centers. And so we all come together on a weekly basis to address the priorities that are the current concerns of the group, which not only have been COVID, but is chronic disease, mental health, infectious diseases, among other health disparities. In addition to that, we have a longstanding relationship with the HBCU Wellness Project and team. In their work, over 50 students across Tennessee are working in their respective communities to provide education around COVID and understanding the perceptions of community members around the vaccine. We're very proud of the work that the students are doing across the state, that our stakeholders are doing, and that our colleagues internally and across our sister agencies are doing, that collectively will help our communities be resilient, shape policy, and really drive current interventions.
Amazing. So there's a lot of conversations in terms of vaccine readiness. So from your perspective, what should communities do to get vaccine ready?
So, vaccine education for reputable sources builds trust, and it increases health care equity in our community and ultimately saves lives. And so we strive to be thoughtful and strategic in our community engagement strategies to meet the needs of communities of color, high risk and vulnerable populations, and increase their equitable access to the vaccine. And so um, African Americans and Latino communities, the things that they can do to get vaccine ready would include choosing to get vaccinated, and making sure that you get the recommended number of doses, sharing the reasons why you decided to get vaccinated and encourage others. Um, Also, learning how to have effective COVID-19 vaccine conversations. I mean, just getting involved as much as you can, being that trusted messenger within your family, your community, and your circle of influence. Our office has been doing ongoing engagement with stakeholders, including our federally qualified health centers across the state, to continue to identify partners within our faith-based and community-based organizations to expand community access in communities of color. And so, we've been doing that by trying to provide relevant resources, driving people to our COVID-19.tn.gov website that includes a wealth of information relative to the eligibility criteria, scheduling appointments within your respective county, data, relevant data, as well as videos and resources that provide fact and dispelling the myths that may come about around the vaccine. And so we just encourage you to connect with us, connect with other trusted messengers within your community to take the hand of our older adults in the community who may have trouble having access to the computer to even log on to the website and understand how to schedule an appointment. Connect with your local health department. There are local numbers within your respective county that you can call if you have issues with trying to schedule an appointment online. Just trying to make sure that we help one another. Uh, Having issues with scheduling an appointment isn't necessarily um, challenging just for our older adults. It can be challenging for anyone. And so we work to help schedule those appointments. So if you know someone that's having a hard time scheduling an appointment, connect them to us, connect them to your local health department. Or if you have access to a computer, help walk them through the process.
So I want to go back because I want to make sure that I have you repeat the website of how people can connect with you. And then also, is there a number that they can call? So if you can just tell us that website and that number, because you talked about a lot of great information and
Mhm.
resources, and I want to make sure that all of our viewers know how to access all the resources that you just shared.
Yes, and the website is covid19.tn.gov.
COVID19.tn.gov.
Yes, ma'am.
Okay, got it. And you
Yes.
mentioned a number. So is there like a general number, and then they can get connected with their area? How does that work, or is the website the best resource?
Well, there are numbers that they have within your respective county. However, you can call our public information number, which is 877-857-2945 as well.
Perfect. And we're going to definitely put that in the comments below. So if you did not get a chance to write down that website and phone number, no worries. We are going to put it in the comments below so that you can access this great information. So, Monique, we've talked a lot about so many different things, but I want to go and get your perspective on one question. It's a pretty simple question to some, but I think your lens is going to give me a broad view of this. What does community mean to you?
So for me, community is huge. I place a lot of value in community. Community is where you can find safety and trust. Community shouldn't necessarily be dictated by size, but your ability to grow within that community, a place where you can find peace, encouragement, and strength. Community pushes you to be better. We all know the saying, when you know better, you do better. And
Mhm.
so in this time, I feel like we should use this moment in time to make us stronger, kinder, trustworthy, building trust amongst each other, and just educating ourselves.
Mhm. I love that. Stronger, kinder, trustworthy, and educated. Those are four powerful aspects of a community.
Thank
And
you.
I'm excited that you highlighted that. I want to pivot to a lot of people are saying, okay, I'm quarantined. What can I do to maintain my health during a
Mhm.
pandemic? And you have a lot of resources, but what would you share with people who are asking that question?
Well, I would say definitely wear your mask. Keep your mouth and your nose covered by wearing your mask. Double mask if you can. Wash your hands often. Continue to stay at least 6 feet apart from others. And even after you have been vaccinated. Um, Also, now is not the time to stop wearing your mask.
Mhm.
Um, I mean, even though after you get vaccinated, there's still a likelihood that you can still contract COVID. So we want to make sure that we're still continuing to do those precautions that we've been doing throughout this past year until we reach herd immunity. Getting the COVID vaccine gives you that added layer of protection against COVID-19. But we also want to make sure we're continuing to protect our family and everyone around us. So the COVID-19 vaccine can help you to do that. It'll protect you from mild to severe illness relative to COVID. So again, now isn't the time to stop wearing your mask and doing those necessary things to keep you and your family safe, and your neighbors safe. Like I said, washing your hands often, staying 6 feet away from others, and wearing those masks.
Absolutely. Now, where can people go to get information about herd immunity? Because a lot of people don't know what you mean when you say that. Are you able to share a little bit about that? And I'm assuming they can get that information as well on your website.
Yes, feel free to, like I said, we have a wealth of information on COVID-19.tn.gov. If there's ever resources that you feel that you want to learn more about that you don't see on our website, go to the CDC's website. Also, you can reach out to us and let us know. We'll be more than happy to make sure that we're giving you relevant and timely information that you need to make informed decisions about your health.
Absolutely, absolutely. So, for those of you all, please visit the websites and you can get more information about how to stay healthy during the pandemic, things that you can do to stay educated and empowered, and also information about herd immunity. So, Monique, is there anything else that you would like to share with our viewers?
I just want to take this opportunity to just thank you all for the things that you're doing. Thank you to Meharry Medical College for being a great partner and all the work that you all do to help us to address vaccine hesitancy in the African American community and other communities of color. We want to make sure that we're mobilizing the vaccine in our communities statewide, in our rural communities and metros. And so, again, if there's anything that we can do to assist you, please don't hesitate to reach out to our office.
Thank you again for being here with us today. And for our viewers, one thing I can tell you about working with Monique Anthony, she honestly means if you need any additional information, reach out to her office. She really wants you to reach out to her office. So the website will be listed below for you. And as always, I hope that you have found this episode of Wellness Wednesdays just as informative as I have. So for our viewers around the world, I invite you to join me back next Wednesday for TNCO Wellness Wednesdays. You won't want to miss an episode, and be sure to share this message. Until next time, stay healthy, stay informed, stay engaged, and share this message with your community. Take care, everyone.